So since it's the top of the hour, let's get started. We actually have a lot of great material for you. Welcome to today's webinar, EHR Implementation Success, How to Avoid Blind Spots That Cost Millions. This is a partnership between Locktera and Bear MCG. And I'd like to give you a taste of what's to come. So let's just do a quick run against the agenda to talk about this. And before I do, I just want to make sure that we are recording. So let's just check that. Uh, we are recording and we should be good for that. Very good. So thanks. Today's agenda include basically going over the challenges of EHR implementations. And there are not only a lot of challenges, there's a lot of signs and symptoms that will let you know what actually might be going wrong and things to avoid and know ahead of time before you start an implementation. There are actually a number of costs and things you should be aware of. And the great thing is, after going through these types of issues that we know about, in particular that Bear has had experience in since they've done dozens and dozens and dozens of these, we'll actually talk about how to avoid it and the ways that you can actually solve for these problems. So it's going to be a very valuable session if you're involved in anything related to EHR. And we'd like to jump in and actually do a little bit of an introduction. Just to start with myself, I am Locktera's CTO, and I've been an IT professional for over 30 years, working as an infrastructure architect for the largest enterprises in the world. 1/3 of that time actually was at Abbott Laboratories, where we were under just about every mess of acronyms you can imagine for regulatory means. So HIPAA, CFR Part 11, I dealt with PHI, PII, and everything else related. When I first started my career there, we usually had to actually sign physical pieces of paper, walk it over to our manager's desk, get them to sign it, and then walk it over to another desk and get it approved before I can even go hands to keyboard. So used to very highly regulated environments. And I'm currently the CTO of Locktera, which is all about actually having a secure storage vault and dealing with those regulations. We'll talk about that in a little bit. The others that we have here today is actually a great crew. We have Sandra Rivas, who's the executive vice president and co-founder of Bear MCG. They're a company that actually helps with not only EHR implementations, but many, many different types of implementations with a specialization in health. And in particular, Sandra brings 15 years of experience leading change within population health management and corporate wellness organizations, 10 years specific to healthcare. And her specialty is working with healthcare leadership and understanding the concerns that they face on a regular basis. And that's going to be one of the first parts of this webinar. It's going to be a very interesting part and useful for you. Denilson Silva is the president of Bear MCG and has been involved in project management for nearly 20 years. He has experience in varied industries, technologies, and from small companies to enterprises. So he has a very broad base of experience to bring to this. And he's also a major in the Marine Corps Reserves. So that's who you have speaking to you. I'll be introducing them as we go through the presentation for different parts. But very briefly, the partnership that's bringing you this is Locktera and Bear together into one solution. Now, what Bear MCG does, as we've talked about before, is help you implement your either health or other related systems. This includes both project management and change management, everything related. If you actually need anything related to the PMO or CMO function, they actually have a lot of great solutions for you and a lot of staff to tap in order to get it done, even if you're not staffed up to handle a major change like the one we're talking about with EHR implementations. As part of that project, you are necessarily going to be touching on a lot of secure documents that are sensitive and probably shouldn't be shared with everybody. So they paired with Locktera, which is ourselves, who can actually have a secure storage vault so that you can successfully share it and meet all the regulatory requirements. We'll talk about how that works in the rest of the presentation, but this is a great partnership. Anytime you work with Bear, you automatically get a Locktera storage vault, and that will actually hold true not only during the project, but after the transition and when you go into production, since you continue to need to store secure documents going forward. So this is one solution that comes together very well. For this part, I'd like to hand it over to Sandra, who, as I mentioned before, has a lot of experience working with healthcare leadership and understanding the concerns that they face on a regular basis, but especially for EHR implementations. So, Sandra, would you mind taking it from here?
Absolutely. Thank you, Randy. Before we actually dive into the EHR implementation strategies that we're going to share with you, it's important to understand what's actually at stake for healthcare organizations. So, if you're an executive, you have a very good understanding of what these concerns are. You may have already lost some sleep over them at some point. But even if you're not an executive, it's important to understand why these are boardroom level concerns because they're critical to your work and it's going to directly impact those priorities as well. So I'm not going to spend a lot of time on this slide. I'm not going to read through each and every one of these, but I do want to share some stats that are important for you to keep in mind as you're aligning your implementation approach with these concerns, because at the end of the day, that's going to make it more likely that that implementation is actually going to be successful. So for CEOs, these initiatives are massive investments. They represent on average about $31,000 per bed. And for large healthcare organizations, that can reach up to $319 million. So they also have serious regulatory implications. And these are things that we found in studies that up 72% of CEOs have regulatory compliance at the top of their list of concerns for EHR implementations. So absolutely something to be very cognizant of as you're implementing this. For CFOs, they're worried about capital planning, revenue disruptions, and obviously cost control. And yet, a Black Book survey found that 72% of organizations actually underestimate the total costs of their EHR implementations by about 27%. And now I'd like for you to imagine being in a COO's position. They have potentially are going to be facing, and they know they're going to be facing up to or more than a full year of workflow disruptions. And yet they still need to deliver quality care every single day. So that's the reality they face because a Mayo Clinic EHR study actually found that workflow disruptions tend to last for about 9 to 15 months after the initial implementation. And that's, it could take even longer for ones that are not as organized. And that's, before they actually see that go back to baseline. And then another thing to keep in mind is that 61% of healthcare organizations report an increase in security vulnerabilities, particularly during the data migration phase. So for CISOs, they have to balance those cybersecurity threats as well as third-party vendor risks, all while making sure that they can maintain their business continuity. So as the note in the corner highlights, we're only scratching the surface with this slide because there's a lot of other roles in the organization at the leadership level, like CMOs, CNOs, general counsel, and they all have their own concerns and they're very valid because they all have a stake in a successful EHR implementation. So as we move forward, we're going to talk about how we can address these different issues, these different concerns by integrating both project and change management, which is something that we specialize at Bear. So I want to give those concerns a little bit of context because they're not just theoretical. They actually represent the real risks that we see on a regular basis. And so to get a better understanding of what these impacts are, I want to examine probably one of the most troublesome EHR implementations that we've seen in the past decade. So the project was originally a $16 billion Cerner EHR implementation for the VA. Their goal was to modernize their legacy system, which was Vista, and integrate it with the DoD. And they chose one single site to pilot this at, to roll out in 2020. And this was something that ended up in disaster, as we can see by some of the outcomes here. So in that one site, over 3.5 years of implementation, they saw over 826 major performance incidents. And these were system failures that led to missed referrals, they had lost orders, medication delays, and as a result, there were over 180 patient safety incidents. That unfortunately meant that 6 of those were catastrophic harm incidents, and even more unfortunate were the fact that that led to 4 veteran deaths. So, aside from those patient safety incidents and the system failures, the site costs also exceeded their initial estimate by 220%. So for a site that was estimated to cost $10 million originally, they ended up spending $22 million. And again, one site, only 3.5 years. This implementation has been paused since they first started because, as you can imagine, they had severe issues to deal with. And they only recently picked that back up in the past month or so. They are very cautiously proceeding with some implementation at some pilot sites again. And the thing about this particular incident is that it has taught us some really valuable lessons about some of the hits or misses that actually Denilson will talk a little bit about later on. But it's also the importance of why we need to integrate both project and change management as we're doing EHR implementations. And so while this represents a very extreme example, this is also something that can happen at pretty much any organization, any size, anyone that's working in the healthcare space. They can see variations of these different issues that they're experiencing. And that's why we're also very deliberate in the methodology that we use at Bayer, because we want to make sure that we're addressing all of the potential for this to happen. Now, aside from the IT consequences, EHR implementations can have consequences that reach way beyond that. So we're going to talk about the different repercussions that they can face as well when an EHR implementation goes wrong. So during EHR implementations, physician burnout becomes a very serious concern, with over 40% of them reporting over 2 hours of additional documentation time. And that's time that can be better served with patients, as opposed to spending it documenting, their clinical notes. And there's also an increase in their workflow challenges as well. So 63% experience workflow disruptions that last over 6 months. And so again, this is creating a prolonged recovery period that's going to impact the organization's productivity. And then most concerning, obviously, in healthcare is patient safety. And unfortunately, with EHR implementations, we see 37% of organizations that encounter patient safety related incidents during the EHR implementation period. And aside from these measurable impacts, there's also some more intangible. So things like reputation damage, that's going to affect your patient as well as physician recruitment and what their perception of you as an organization is. So that's absolutely something that we want to account for as well. And then, of course, revenue cycle disruptions that can last 3 to 9 months and possibly longer, depending on the implementation. And then lastly, unplanned staffing costs, because the longer an implementation has to run, the more you have to worry about being able to plan for the go live support that you have at the site, as well as for your clinicians as well. And so these consequences demonstrate why it's so important to actually get the implementation done right the first time, which is something I wish the VA, I'm sure, wishes they had done. And so with that said, I'm going to hand it over to Denilson, whose vast experience in project management. He's able to prevent these outcomes by integrating both of those, and he's going to walk us through what went wrong with the VA.
Thank you very much, Sandra. So what is the whole discussion, the whole purpose of all of this that we're talking about is essentially what you see there on the slide is PM and CM, the project management and change management integration. And what do we take from the statistics that Sandra mentioned? What that comes with the change management failures, which compound project management struggles. And these are all things that need to be taken into consideration. That means that project management and change management are inherently linked. So let's discuss both of those. Project management, what is that, and what is change management? Project management is the temporary activity to deliver a unique product or service. That's the PMI definition for it. That is the what and the how for any endeavor, any short-term activity that you're doing. The change management is a systematic approach to dealing with the transition or transformation. How do you actually go about implementing whatever it is that you set out to achieve? And that is the why and the who. A project without a why is essentially just wasted money, wasted time. So you need to make sure you know why you're doing a certain activity and who it's uh, it's uh, it's addressing and who it's actually going to help or further. So a perfect project, a perfect go live, it can be a failure if nobody adopts the change. So that's why we talk a lot about this as a PM and CM integration. I've seen a $2 million financial software implementation take months to be fully useful. And the reason for that is the leadership, they didn't want to focus on change management. They didn't want to take any recommendations for change management or even pay for a change management consultant. A PM is not a change manager, just so you know. And the result for that was that the staff, they were still using their old spreadsheets. Mind you, they spent $2 million on a financial software while the staff decided to revert back to using their tried and true formulas and the spreadsheets that they were used to. That's the implication for that was they had monthly budget and forecasting reports that took 3 weeks out of the month to complete. You can imagine the impact that that would have on the department. No time for strategy, no time for regular operational duties. They all had to focus for 3 weeks on budget and forecasting when they had a system that did all of that for them. Poor change management created this problem that it took months for the company to finally be able to adopt that new system that they paid for. So you must involve change management from the start. And that's what, that example that I gave, they didn't want to do. They didn't want to bring it in from the beginning. It was more of an afterthought. Usually I've seen this in my career. I'm sure a lot of you have as well. 1 month before go live, let's think about training. How are we going to train these individuals, the end users? And let's just tell them, hey, this new system is up. Many times, too many times, I've seen where an email sent out, hey, now we're using this new system. Nobody was told about it. So change management needs to happen from the beginning. And we at Bear Management, we actually mapped out this relationship and the work that goes into ensuring that change management success happens from the start of the project management work. So change management is intrinsically tied to project management, and it needs to be a major focus. This actually ties into our next slide. As we were preparing for this presentation, and actually as we've done this in the past just for our company, we identified 101 signs and symptoms from project management and from change management that you need to address and you need to focus on. So let's talk about this. We call this the clinical presentation of EHR failure, just to tie it more with EHR, right? These are the 101 problems that contribute, and we've seen this in the example that Sandra gave of the VA. A lot of these issues, a lot of these problems contributed to the VA's EHR implementation failures, struggles, problems. We couldn't fit all of it into one page. So you have that QR code right there. You can just take your phone, take a picture of that QR code, so you can get the full list of 101, and also so you don't have to read all of these on the slide. We just picked out the top 5 for each of the different project management phases, the implementation phases, initiating, planning, execution, monitoring, control, and closing. Those are PMI, Project Management Institute phases. And so we just picked the top 5. We're later on going to focus on the top 3 that you see there, the ones that we feel you really need to know about. And we just wanted to actually drill down into and give you an example of something that you really need to have a deep consideration of. Now, the bottom line up front is that you need to consider these as you prepare for your kickoff and as you transition to execute for your projects, not only for EHR, but for the projects in your organization as a whole. And these problems are solved for in our governance models. These are the change management ones. And so we will be discussing these more later on. And With we are in project in Bear MCG, we are champions of change management and involving change management as early as possible. And that's why you see on this slide for the change management, they follow the PMI project management processes. And we wanted to actually show how you're as you're implementing a project, change management is involved in each one of those phases as well. And there are considerations you need to take for each one of those phases, even though standard change management methodologies like ADCAR from ProSci or McKinsey's model or Cotter, they have their own methodologies, they have their own phases and their own stages. However, all of that falls into the project management phases, whether you're using the standard waterfall model from here or agile, change management is tied to it, and you need to have that as a consideration. And we actually address that we prevent these and address these problems at an organizational level, not simply just per project, but as an organization to make sure that the organization itself can adopt both of these as an integrated unit. So with that, I wanted to give you that overview of the project management and the interlink between project management and change management, and tied that back to Sandra's example of the VA, why the VA EHR implementation failed. So now that we understand the project management and change management link, and we're going back to the VA, we've identified 5 key themes that led to the VA struggles and how project management and change management and also security failures led to them. Of course, we needed to bring in the security aspect of it because it's an EHR, a lot of PHI, a lot of PAI, a lot of information out there that needed to be controlled and secured for. So the what about it is, again, the integration and the relationship. You need to understand the implications of not having that uh, thought about and planned for early on and all along the entire implementation. So going through these, the first one, the technology, the misalignment between system and organizational needs. So what is that? That is essentially the technology supports business. That's what you need to take from that number one, is that the vendor, the implementer, they did not adapt to the VA. They failed to get adequate requirements, and the VA is unique. It's a unique organization. They serve a very particular customer, only veterans, and they had very unique requirements because not only is it a healthcare organization, it's a tied to the military, and also it's a government entity that actually has a cabinet level individual overseeing it. So this is a very unique organization that you need to plan for and take a lot of these different aspects into consideration. From what we've seen, the examples and what we read about this case study, the vendor did not really take that into account, either on the change management, the project management, or even on the security side. And the second one there, inadequate training and support. So training needs to have the end user in mind. It's not simply covering the system functionality, just making sure that you teach a person, press this button, go to this text box and hit send. There are actual implications when you don't teach the system based on the user. The VA's implementation did not focus on the end user. They just taught the functionalities. It did not have enough resources to staff to train the VA staff. And so that's a critical failure also, is you need to make a deliberate planning for training and be able to supply the training to the end user with enough individuals to facilitate that training. And it cannot be an afterthought. The change management ensures that starts from the beginning. They understand who the end users are right at the beginning and start planning that training and that transition to adopting the technology. For number 3 there, the poor system testing and safety controls. Like training, it didn't include the frontline users. It did not focus on the clinical functions being tested. It was just testing whether this functionality worked. But everything goes right back to the misalignment. The number one right there, misalignment between system and organizational needs. The system is built for the organizational needs. So if you're testing it, you got to test it based off of the organizational needs as well. They did not take that into account. So we can go into number 4 and 5. So 4 and 5, governance and accountability and rushed implementation. The proper governance for projects, for an organization, it can prevent rushed implementations. And that's what we focus on in BMCG, is making sure that there's that governance in place for change management, for project management, and even for strategic alignment, making sure that you're implementing the right project, not just implementing projects right. So that was a miss over here from the vendor, and also from the VA as well, because for number 4, the weak governance and accountability, they did not have the proper controls for the vendor. And so, one, it was a miss because the vendor did not have accountability, but two, it was a miss because the vendor did not have authority to be able to prevent rushed implementations or to enforce go, no go criteria, which incidentally, they didn't even have a go, no go criteria. If anyone from the military, you know exactly what a go, no go criteria is. Perfect example, not VA related, not EHR related, but military related, was Operation Eagle Claw to rescue the hostages from Iran back in, I think it was the 70s or 80s. And there was a go no go criteria. The first widespread known use of Delta Force was, we need to go with 6 helos, 6 helicopters, to be able to be successful. If we cannot have 6 helicopters, we're not going to go. A few of the helicopters were actually down for maintenance. They canceled that operation. It is critical. If you need to set a go no go criteria and enforce it. The problem is the enforcement of it, not just we have a go no go criteria, technically, temporarily, somewhat asterisk. It needs to be a solid, if we don't have X, we don't do Y. So with that, and discussing the EHR problems from the VA, and EHR issues, those 101 overall, and even going back further back to the tie-in between the relationship of change management and project management, we go right back to those 3 highlighted portions from the 101. These are the 3 for project management. The next slide will be Sandra talking about the 3 from change management. But addressing these, the project management failures and EHR implementations, again, you can see a theme here: incomplete EHR clinical workflow scope definition. Fancy wording to saying the business drives your projects. And this did not, if you're starting a EHR implementation, you need to know how your doctors operate. You need to know the business, not only the business workflow that's actually stated, but how they actually move about the clinic or the hospital. You need to know where they go from one step to the next, what their processes are, and you might need to correct that before you even go into the EHR implementation and start even identifying which system you're going to use. So incomplete EHR clinical workflow scope definition, that is a critical aspect that you need to address early. Essentially, scope definition, requirements gathering, but not simply for what system you want to use. This is talking about the business side of it. Inadequate EHR vendor accountability mechanisms. This is where you go into proper contracting, understanding what your vendors provide, understanding the left and right limits of the vendor, and what it is that you expect from the vendor, and being able to vocalize that. And then insufficient testing and risk management. Going right back to what we talked about with training and testing that were failures on the VA side, was make sure you have the end user in mind and cover down for that to make sure that the testing covers that. Now, we'll address the change management failures that we have identified in the EHR, the 3 highlighted ones. I'll transition back to Sandra as the resident Bear MCG change management expert.
Thanks, Anilson. So I want to take a look at the human challenges that in our experience are most likely to derail an EHR implementation. let's assume that you have a magic wand and everything that could possibly go wrong with your technical implementation didn't go wrong because everything went well. You still have to account for the fact that we're imperfect as humans, and we need to make sure that your whole workforce can actually adapt to all those changes that you just implemented. So the very first thing that we see is resistance from your clinical staff and your physicians. So they're usually seen as the problem when they're resisting change. But in actuality, what that resistance is a symptom of a much deeper issue. They're not resisting change. What they're doing is they're protecting their ability to deliver quality patient care when their workflows have been disrupted or impacted because of some changes that you made on the technical side. And so it's important to keep that in mind because that prevents your ability it impacts your patient throughput. It's going to obviously impact your revenues and it's going to impact your workforce. So we want to make sure that we're including them in on the design phase so that they have some input on what those workflows are like and including them as clinical champions past the go live. So that way they can provide support to their colleagues as well, and make sure that they are really championing the need for change and for adoption throughout the entire organization. Secondly, which Denilson already alluded to earlier, is the insufficient training. So want to make sure that specific, I mean, really with any industry, but very specific to healthcare, we want to make sure that we're tailoring your training for all of those different clinical roles. One size fits all training does not work in healthcare. Because imagine giving a chef and giving a gardener the same class on how to use tools and then expecting them to have really great outcomes. It's not going to happen. Same thing happens in healthcare. If you give a cardiologist and a nurse the same generic training, neither one of them is going to get what they need out of it. A cardiologist is going to need to know how their cardiac imaging integrates with their EHR. They need to know how to document really complex cardiac conditions, whereas a nurse is going to be primarily concerned with their medication workflows, documenting vitals, as well as their care planning. So if they're getting that same training that says, click here, do this, they're going to miss out on something, and they're not going to be able to actually complete their work effectively. So you're going to end up with a frustrated staff that's more likely to commit errors. They're going to have slower charting. There's going to be longer appointment times. And what I feel is even more concerning is staff that creates workarounds to bypass the EHR. And so they're creating processes that are going to immediately address their concerns and are going to make their lives a little bit easier in the moment, but they're going to cascade to some serious issues down the road. So things like incomplete records, seeing safety risks increase with patients. Billing delays, documentation, because oftentimes what they're doing for workarounds is reverting to paper documentation to fill that gap in the interim. And so that creates a huge cascade of issues. And that's also where we see a huge increase in those security vulnerabilities that we mentioned earlier. So recognizing that change management issues don't exist separately from the technical issues, and are also inherently very, very married with the security approach, we realize that we have to have a very integrated approach to implementation from both the project management, the change management, and then the cybersecurity concerns as well. And that's why we've partnered with Locktera to be able to provide that. So with that being said, I'm going to hand this over to Randy, who has over 30 years of experience as an IT professional. 11 of those he spent with Abbott Laboratories, and many other years in his career were spent in healthcare. So he has a very clear understanding of some of the most critical security vulnerabilities that you would be facing.
Thank you, Sandra. I really appreciate that. Happy to take this part of the discussion. And I'd like to actually hook on something that Sandra was talking about, where you actually have different training for different groups. So you would be training your nurses separately than you're training your doctors. You also have separate groups that you need to share documents with. Each set of documents might actually only be appropriate for that group, and you actually have to be careful about who you share it with and individually sharing each group with the right set of people. So what you need in order to succeed at this is a way to handle secure data sharing and full accountability for that. And that is a big part of any kind of project that you might be doing. And it's something that Locktera provides as a solution, just like Bear provides solutions for the types of problems that Sandra and Denilson were talking about for both project management and change management as well. As we discussed just briefly at the beginning, you have an exposure to regulatory requirements. And if you have any violations, it can be very expensive. Actually, at least in two ways, if not more. One of those ways is reputationally. If you ever leak any patient data by mistake, you actually have to announce it. And if you have a situation like that, that's not the kind of press that you really want to get. What you want is a very smooth EHR implementation, even if it includes PHI or PII or other types of HIPAA protected information. The other thing that could come out of this is fines, and those can be very expensive. They can be very ruinous. There's a reason why those fines are as high as they are, and that's to incent you to make sure that you just build it in the first place, which is part of why we have our partnership because we have our secure data vault that's part of the project management process, change management process, and even post implementation. And finally, you need to account for post-project data security, like I was just talking about. So you're done with your project. First of all, we've seen it where some project vaults where you had all this PHI and PII still in that vault. And even though the project is over and it's a temporary thing, as Denilson said, that was part of project management, is that it's a temporary thing and you get done with it. The data is not temporary. The data is permanent and you need to keep it secure going forward. Now, of course, one way to do that is to shut down wherever you were storing it, but you actually might want to go back to your project documents and keep it where it is. The other question is how you're going to continue to share secure documents throughout your organization operationally going forward in production. And that's something that we provide at Locktera. And just to talk about it a little bit, at Locktera, we've created a solution which is just simply drag and drop. We take a lot of technology and make it very easy for you to drop groups of files into it and actually have a whole set of layers on top of it that make it very easy. So once you use this drag and drop interface, you actually use file level encryption. Now, if this is not a term you've heard before, to be very clear, when you actually lock up your laptop and your laptop has an encrypted hard drive, that's called file system encryption, which is fine. The problem is all of those files are backed up and locked up with the exact same password. So once they get in, they get access to all of them. However, if you have a set of files that need to go to a contractor and a different set of files that need to go to your cardiology department and yet a different set that go to your nurses and nurse station, all of these things actually might have different groups of access controls and other things that you need to layer on top of it. And because it's file level encryption, you can do that. This is not just straightforward cryptography that we have in Locktera. We're forward thinking. And in fact, we have post-quantum cryptography, which I know sounds fancy, but the truth is, quantum computers are actually being rolled out right now. They're in the conceptual stage, but they've been successfully deployed in a number of different places. And with this exciting new technology comes a new set of changes for the security industry. In particular, there's an algorithm already written for quantum computers that can crack all of the prior encryption mechanisms in seconds, or not even a second, actually, sub-second. And because of that, you actually see recommendations from NIST, which is the standards organization in the United States. And in Europe, they're saying the same thing. And we're seeing it all across the world where they're saying you need to use post-quantum cryptography now. What does that mean? It's a different kind of encryption. It still only takes seconds to both encrypt and decrypt for the most part. And it can be done with a standard computer, and yet it's not basically crackable by a quantum computer because it uses a different kind of mathematics underneath it that's not as permeable to quantum computers. So what they recommend is that you use post-quantum cryptography now. Well, if you use Locktera, all you need to do is drag some files on and then click encrypt, and then choose a few other options. One of it is access controls. So you can choose who sees the files and with what lockdown that you do. So there's a number of different options. I'm going to go over that into the next slide in a second. You also need to have audit logs to let you tell basically who accessed the files and when they accessed it. And you actually need the ability to do organizational level settings, which is to say, if you have 200 people in your organization, the last thing you want to do is have 200 separate accounts and then do the same settings across all of them 200 times. You want to do that in a central place and actually have organizational settings that can push it out. We have all these things in Locktera. It's built into this drag and drop interface. Finally, you need to be able to revoke access remotely in case of a breach. That's the number one thing about cybersecurity you should be aware of. And by the way, we actually talk about this a little bit in a checklist that we have on that same page that we talked about earlier. If you go to locktera.com/bear, you'll actually see some downloads from this webinar. One of them is a cybersecurity checklist. So what does this mean? If somebody has a breach, and it may not be you, it may even be one of your contractors, you may actually have to be able to shut things down and then go back to the audit logs to verify if anybody actually did access the files or maybe not. Maybe even if they had a breach, nobody touched them. Either way, you'll have some proof, which helps you in both the legal sense as well as organizationally to know what you actually need to tell the public in case you have an issue. You should either way plan for these types of things. The other thing you need to do is layer on different levels of security, which we have built into Lactera. So you can share files with authorized recipients. They get full access controls, which means you can decide how and when they access it. And you actually can do authentication using cloud or SSO authentication. The various settings you might do are limiting access by name, IP address, locality, time, date, number of downloads, and actually many others. So there's a lot of settings you can do. The nice thing is the default settings usually work very well for people, but if you need to be specific, you have that granularity that you require. We have a unique structure in Loctera that makes an immutable structure for your encrypted file. And what this means is that the file cannot be adulterated without basically becoming useless. This is a very useful mechanism for example, municipalities that are using our tool right now. We have police departments that need to prove that the data that they put into the storage vault has not been changed, even though it has been encrypted. And so we lock it in an immutable file structure, and then when we unlock it, you know that it's the same as when you put it in. As we talked about, you need to be able to revoke access remotely in case of a breach or issue, and you might need to share large files, and we cover that at Loctera with up to 1 terabyte size. We also collect full audit and access logs, and so the way that you use these, as stated before, is that if there's any issues, you can actually go back and prove that people either didn't access it, or if they accessed it, you can find out where they accessed it from, where their IP address is, and a lot of other information about the time and what they did with it, including downloading it or just viewing it. So you have all of this stuff in order to protect yourself. You should feel very secure that we actually handle everything needed for the regulatory requirements. And speaking of which, among the requirements you might have during an implementation, especially during change management, is that you're training people properly. In order to make sure you've done that training, if you have a department and there's 30 nurses, you need to make sure that all 30 watch a video. So another feature that Loctera has for you is not only encrypting and locking these files so that only the right people can see it, you can actually ensure that all 30 of your nurses have watched the video 100% through. So this is for compliance with any kind of projects you might do. That includes a whole set of features that you might expect. A chain of custody tracking, e-learning documentation that includes both for videos as well as other types of documents, authenticated video sharing so that you know who logged in and who watched it and when, detailed access data that's in compliance with GDPR and many other regulations that you might expect with that, segment by segment video analysis, and finally, real-time insights that allow you to actually have the metrics that you need to manage the change. So at this point, I'd like to actually hand it over back to Denilson because we've talked about a lot of the issues that they've had. They've drilled into what happened during the VA implementation and where it went wrong. And they talked about a lot about their experience that they've had with the dozens and dozens of implementations that they've done that basically could be applied to your project as well. Here's how they handle it with their Align framework. So Denilson, would you mind taking it from here?
Hi, thanks, Randy. Yeah, the thank you for providing all of that with the security. The security, and more precisely, Locktera's solutions, they're critical to EHR implementations. I mean, nobody can doubt that. That's everything that we've discussed. A lot of doom and gloom. I know it's a lot of problems and issues and failures from other implementations, but not everything is lost. There have been great EHR implementations. There's a lot of them that we study and that we learn from as we do our own research to improve our solutions. And that's one of the reasons we developed our aligned methodology. Is just a methodology that ensures that our projects, the change, and the strategy solutions are all aligned and synced up, and they're all integrated and can function throughout that entire flow. The assess, link, initiate, guide, and nurture. Now, we are a people-focused and project-centered and a strategy-aligned organization. Your organization needs to have these processes as well. It doesn't need to be these ones, but you do need to have some sort of link between your strategy, your projects, and your change management, and know how they function together. We constantly ask a lot of customers and a lot of different individuals, why are you flawlessly delivering the wrong project? Strategic goals, they drive projects, but project value realization also drives future strategy. So you should focus on strategy alignment and making sure that you have a good project selection process, and also a focus on project governance. You need to deliver those projects right. And also you need to focus on change adoption, ensuring you shorten that adoption timeline from when you deploy or go live with your projects. So we do all three by providing organizational structure, and we do that through our an enterprise PMO, a project management office, a PMO, a project management office, and a change management office. And we have our own solution names for those. But all of that is just to say that you need to have these considerations as well, and make sure that you cover down on those to make sure that not only your EHR implementations, but all your projects run successfully. So before you even establish that strategy governance, the change organizational structure, and your project governance, you need to know your starting point, and you need to take time to assess yourself. This isn't done in just a whim of, I think it's a good idea if we just start doing some governance. You need to actually understand where you stand right now. And that's one reason why we created our individual assessments. These individual assessments, we look back 3 years. We look at three major projects or initiatives, and we provide three impactful recommendations and associated action items. The project to strategy assessment is tied to that strategy, the EPMO, and making sure that your projects complete, or your enterprise projects, they actually drive value and drive your strategy. The project governance assessment is, how well are you implementing your projects? Are you implementing them consistently? Are you actually establishing good metrics or a good rhythm for meetings, for data, for information and presentations that you give on your projects? And then the change readiness assessment, that ensures that tracks your maturity on being able to adopt change. Is your team, is your staff, and your employees ones that actually can adopt your change and know that whenever there's a change, everyone is full force forward, moving to one beat, knowing that they're all just going to take this on and adopt it? But also, do you have a change readiness assessment for your customers, for your patients, or, if you're an implementer for your customers, do you have a way to drive their change and help them actually adopt to the changes of your projects? So with that, covering down on our solutions, we'll turn it back to Randy. I'd like to say thank you for taking the time to see this webinar, to be a participant in this. Hopefully you learned something and you can take back some good information along with that 101 uh, uh, problems and issues that you need to look at. So I'll turn it back to Randy to close us off.
Thank you very much, Denilson. Yes, what you should do right now is go to locktera.com/bear and you can download the PDFs that we talked about today. All of that info is available to you. That 101 is actually 201 because there's 101 for project and 101 for change. So you're getting 2x the number of problems and signs and symptoms. Although you should be aware of these so that you can actually get around it by making sure that your project plan and your change plan actually handles this. You can also book a Bear MCG strategy meeting to talk through your own implementation, which I highly recommend. It's free. It's very straightforward to do at bearmcg.com. And finally, follow us on LinkedIn for more webinars like this one. We actually have plans for others to talk about implementation, things that you should be aware of as you handle all of these change and project management around major health systems. And we're really looking forward to providing you with a lot of valuable information and giving you a lot more valuable webinars in the future. With that, Sandra and Denilson, thank you very much for joining us on this partnership. I really appreciate it.
Thank you, Randy, and thank you all for
Thank you.
attending.
Thank you very much and hope to see you for the next webinar.